Hello, and welcome to our presentation, Know Who is on Your Side, your lupus nephritis team. I'm Annika Hazlitt, a member of the Board of Directors at Kaleidoscope Fighting Lupus, and your host. Lupus nephritis is one of the most serious complications of SLE. It occurs when the immune system mistakenly attacks the kidneys, leading to inflammation and even kidney damage. Studies have shown that over time, up to 60% of lupus patients will develop lupus nephritis, including over half of children with lupus. If you or someone you care about is diagnosed with lupus nephritis, or LN, you'll want to know what healthcare providers are on your team, who will help with your treatment plan, and so much more. Since LN targets the kidneys, you know that a nephrologist will be part of your team. But who else is there to make sure you get the best possible care? Today we'll be hearing from a variety of healthcare professionals whose specialties are part of the LN treatment team. We will hear from Dr. Emily Puukka Clark, a primary care physician in family medicine, who will describe her role as a point person in the diagnosis and treatment of lupus nephritis and how it affects overall health. Dr. Sharon Dowell is a practicing rheumatologist and professor at Howard University Hospital. She will describe the special role of the rheumatologist, how she approaches diagnosis and disease management, and even how to prepare for your rheumatology visits. Angela Farrar-Small is a licensed clinical social worker and therapist who will discuss how she helps treat the cognitive and emotional aspects of living with lupus nephritis. We will also hear from John Alder, a licensed pharmacist who will describe his role and the unique perspective that a pharmacist has in advising you on medications and many other practical aspects of your treatment plan. Before we begin, I'd like to take this opportunity to thank our presenting sponsor, Aurinia Pharmaceuticals, for their generous support in making this event possible, as well as additional support from 7 Minute Cinemas and Blue Eyed Crow Studio. Now, let's begin by hearing from primary care physician, Dr. Emily Puukka Clark.
Hi, I'm Dr. Emily Puukka Clark, and I'm a primary care physician in the field of family medicine. So how does your primary care physician fit into your lupus and lupus nephritis care team? Well, I think the primary care physician should be involved in any and every part of your disease process. Sometimes in primary care, we may be seeing patients before they even have the diagnosis of lupus. A patient may be coming to us with new symptoms or new concerns, wondering what's going on. I think a big part of our job is to listen to the patient and hear what they've been experiencing, hear what their concerns are, and then start to figure out how we can help. Lupus is a complex disease that can present in very different ways in different patients. Oftentimes, it doesn't fit into the neat box that we read in medical school textbooks. So part of my job is to think about what's going on here and can I come up with a unifying diagnosis? The workup can involve a more extensive physical exam. It may include some laboratory studies like blood work or urine tests. It may include some imaging. Once we feel like we understand the diagnosis and a diagnosis of lupus has been made, the next step is really to determine where do we go from here? Who should be involved in this patient's care and what kind of support do they need? Sometimes the role of the primary care physician depends on the stage and the complexity of a patient's lupus. Lupus can involve almost every organ system in the body, and so sometimes patients need multiple specialists involved in their care. This can depend significantly on where a patient lives. If someone is living in an urban area or a larger city, they may have very good access to different specialists to be involved in their care. For other patients who live in a more rural area, they may have no access to specialty care or specialists may be hours away. In those cases, the primary care physician may be taking a more active role, and the specialist may be involved in a different way by phone consults and chart review, etc. Sometimes I think patients wonder about who they should talk to first, especially in the case of having multiple specialists involved in their care. That can sometimes feel confusing and overwhelming, and sometimes it can be really difficult to get in for timely appointments or to have a new concern addressed. I hope that patients always feel comfortable to talk to their primary care physician if a new concern or a new symptom has come up, and they can help decide and recommend if that's something that can be managed in the primary care setting or if it might be appropriate to get another member of their healthcare team involved. Part of the role of the primary physician is to determine what do we think is going on and who is going to be the best person to help address that concern. Oftentimes, a patient's primary care physician may be the most trusted member of their healthcare team. You may have been seeing your primary physician for years. They may know your history well. They may see other members of your family. And in that way, I think in primary care, we're poised to offer patients a unique and special type of support, especially when they may be going through more difficult times. At the time of a new lupus diagnosis, that can be really overwhelming. Patients can have a lot of fear, they can be angry, they can be scared about what's to come. And I think your primary care physician can really help offer support and help you realize that you're not alone in navigating this process. I think it's really important that patients have the appropriate mental health and emotional health support, and that's something that I think the primary care physician can offer. I hope you always feel free to reach out to your primary physician and let them know how you're feeling and see how they might be able to help. As one of the many members of your lupus and lupus nephritis healthcare team, I want to ensure that you have all of the support you need to have the best possible outcomes and have your treatment be optimized as much as possible. Thank you.
Hello, my name is Sharon Dowell and I'm a rheumatologist. And I want to talk to you about what I do and how I fit into your healthcare team. Now, all of you should know by now that lupus is an autoimmune condition. And what does that mean? It means that your immune system is not working well and has caused the development of chemicals called antibodies that attack your body's own cells, tissues, and organs. Well, rheumatologists are experts in treating autoimmune diseases, and therefore we are an essential part of your healthcare team. In addition to monitoring your lupus nephritis and making sure that that is being well treated and under control, we will see you regularly to check to make sure that your lupus is not affecting any other part of your body. And in order to do that, we will be talking to you to assess your symptoms and what has happened since we've last seen you. We may ask you to fill out some forms that allow us to assess these symptoms in more detail. Additionally, we will do a thorough physical examination. So when you come to see your rheumatologist, expect that we will ask you to get undressed fully and into one of those hospital gowns, because we want to check your skin and your joints and do a full and thorough examination of your body. When we're finished with our visit, we will send you to get blood work and urine tests done. And this can actually really help us to assess how active your lupus is, as we can measure inflammation markers. And it can also give us a sense of whether there is a burgeoning or a developing lupus flare. So blood work is also a very important part of our assessment. If you are doing well, we will probably see you again in about 3 months. But if there is any sense that there is a concern or anything amiss, then we will see you more frequently so that we're vigilant for any developing symptoms. Besides making sure that your lupus is not causing any additional problems, we have, as rheumatologists, a lot more comfort and expertise in prescribing or dealing with the medications that treat lupus. So we will work with you and with your other providers to make sure that we devise the best strategy and the best treatment plan for you. But someone needs to take responsibility for prescribing these medications, for monitoring them for side effects, and also to liaise with your insurance companies or providers to ensure that you have the right authorization and approval to get these medications. When monitoring, it will really depend on the medication that you're taking. For most medications, we will do labs and urine tests to check to make sure that there are no effects on your other systems. Additionally, Some medications will require that you have certain vaccinations, and we will want to make sure that you do that prior to starting them. Some medications can affect fertility, and so we want to have that conversation with you as well and talk to you about the need for contraception in certain cases. We also talk about life planning, and I will admit that this is something that your other providers will do as well, so there's great overlap here. But we will talk to you about your diet and lifestyle, foods that you should avoid in order to avoid having a lupus flare. We'll talk to you about pregnancy and pregnancy planning because a lot of our medications, as we said before, can be contraindicated in pregnancy or if you're thinking about pregnancy. And we'll talk to you about work and school and make sure that you are aware of the accommodations that you may need and that may be necessary for you to be productive at school or work. And sometimes we can be involved in disability determinations if a specialist's opinion is needed. In cases where you may benefit from participation in a lupus clinical trial, we will also be the ones to advise you on this, so make sure to come to us. Ultimately, we work closely with your other providers to ensure that we are covering all aspects of your physical and emotional health. We're covering the whole and entirety of who you are. And as one of the many professionals on your healthcare team, I am committed to giving you the support that you need. Thank you.
Hello, my name is Angela Farrar-Small. I'm a clinical social worker and mental health provider. So, how does a mental health provider fit into your lupus nephritis healthcare team? While a person with lupus nephritis might be reluctant to add one more healthcare provider to their list of providers, having a mental health provider can really improve the overall quality of life you experience as someone living with a really stressful autoimmune disorder. First, a few definitions, just to clarify who I mean. Who do I mean when I say mental health provider? There are many different degrees and credentials that compose the wide world of mental health care providers. I use that as a general umbrella for psychologists, psychiatric nurse practitioners, clinical social workers, licensed mental health counselors, and marriage and family therapists. What we have in common, despite our credential, is the ability to support people with compassion and to help people move forward and improve their mental health and improve their quality of life. The credential also is not as important as the comfort level of the person you're talking to, how comfortable you are with them, how comfortable they seem to be in listening to your concerns. Graduate school training covers many approaches, so sometimes people have questions about what exact approach would a mental health provider use. Well, that partly depends on you. We're trained in many different ways to help. We're trained in different kinds of theories and interventions, and so we partly take our cues from you. Again, what's comfortable for you? We often combine approaches also because we recognize that that can be a stronger approach than just having one way to go. One of the big advantages is the gift of time. It is rare to never that a patient has 50 minutes uninterrupted time and attention from a physician. That's a big advantage, to have time and space to talk about whatever you want to talk about in whatever way feels natural to you. Another advantage to having a mental health provider on your team is the wide range of topics you can explore, because we don't say, oh, we can't talk about your symptom over here because I specialize in that. In terms of your life experience, you can talk with a mental health provider about all of it, particularly if your mental health provider is someone like me who specializes in the care of people with chronic illnesses. Mental health sessions give you time and freedom to express all your concerns. Concerns about the changes in your body that you're experiencing, concerns about the changes in your daily life that you're experiencing, concerns about the changes in your relationships that you may be having, and concerns you have trying to navigate a complex and sometimes cold healthcare system. We want to be the place where you're free to share all of the experience without worrying about how the other person who's listening is going to feel. Many mental health care providers who specialize in chronic pain and specialize in chronic illnesses come from medical settings and were trained in hospitals and clinics. I have experience with hospitals and clinics, and so therefore, one of the things that I enjoy doing is helping my clients understand how the healthcare system works, who the various players are, what roles they play, and help a person navigate the mental health care system and the medical care system. Clients who have a mental health provider really come to appreciate the advantage they have that they can just talk freely. Again, they don't have to worry about hurting my feelings, so they can say whatever they want to say about their life experiences and what's working and what's not working so that we can come up with a good plan for their care. One of the things that I have done in my career, specializing in chronic illness, is facilitating family meetings. So sometimes if you're working with a mental health provider ongoing as an individual, but you find that a family meeting is helpful to kind of clarify roles within your family system about who's going to help and who's available to do what to support you in your chronic illness, a mental health provider can be that person who facilitates that meeting to help give people an opportunity to share their worries and to also provide support and offer ways to be of practical help to you. With assigned release of information, I'm allowed to communicate with your other healthcare providers. A mental health care provider can help translate for other providers some of the struggles that you're having, if that's helpful to you, and also with assigned release of information. Also, with assigned release of information, a mental health provider, just like your other medical providers, can help you with paperwork to apply for family medical leave and requests for ADA accommodations in your workplace, in your home, and in your educational setting. You may not have considered the benefits of having a skilled mental health provider on your team, but we can provide some unique opportunities in your healthcare journey. We can provide a way for you to have a forum uninterrupted, to just speak and to share and to process what's going on, and to work with you then from our place to support your connections to others, to support your daily life, to support you in getting accommodations if necessary, and to support you in how you're managing your thoughts and feelings as you're living with a chronic illness. So please consider having me or another mental health provider join you on your lupus nephritis team. We're here to help communicate between other providers. We're here to help support you in your experience to feel better emotionally. We're here to help you navigate the healthcare system if necessary. Thank you for listening, and thank you for considering having a mental health provider on your team.
Hello, my name is John Alder, and I'm a licensed pharmacist. So how does a pharmacist fit into your lupus nephritis healthcare team? Well, as a pharmacist, we go through extensive pharmacological training on the chemistry of medications, possible drug interactions, and side effects, from the very basics of when and how to take your medications to the understanding of why. As part of your healthcare team, we can monitor medication tolerance and other conditions such as high blood pressure and diabetes, which might affect treatment decisions. Medication management is critical in treating lupus and lupus nephritis, and most times it involves multiple therapies. Confusion is not uncommon, and adhering to treatment is primary for effective health care. Please keep in mind, no question is too small. No one should hesitate, no matter how insignificant your question may seem. We are frontline for a reason. As pharmacists, we can help alleviate the confusion through counseling, which contributes to achieving successful clinical outcomes in the management of not only lupus and lupus nephritis, but other autoimmune disorders. We are often able to give you recommendations about alternative first-line medications, such as corticosteroids and antimalarials, when that can be helpful. And as one of many professionals on your healthcare team, I am committed to giving you the support you need. And although there is still no cure, advances in the treatment of lupus nephritis have led to significant improvement in the quality of life. And that is, after all, the therapeutic goal we are all looking for.
Please join us in thanking all of the speakers for their perspectives about how they fit into the healthcare team of someone living with lupus nephritis. We hope this gives you a better insight on how they view the roles and what you can expect from them as members of your healthcare team. This brings us to the end of Know Who is on Your Side, your lupus nephritis team. We hope you found it helpful and informative. Once again, a special thanks to our presenting sponsor, Aurinia Pharmaceuticals, for their continued support of those living with lupus nephritis. We also thank 7 Minute Cinemas and Blue Eyed Crow Studio for their help in making this presentation possible. Finally, we want to thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, and award-winning blog articles, and so much more. Thanks for spending time with us. And remember, you are not alone. I'm Annika Hazlitt for Kaleidoscope Fighting Lupus. Know that we are here for you, and please take care.